Welcome back to the Best PT Podcast. This is episode 8.2, Genitourinary pathology. Beginning with the uterus, we have endometriosis, which is the development of uterine tissue in extrauterine locations. Signs and symptoms include moderate to severe abdominal, pelvic, or low back pain before or during menstruation, irregular menstrual cycles, spotting, pain with defecation, and infertility. Treatment involves manual therapy, visceral mobilization, relaxation exercises, TENS, and pharmaceuticals. Uterine prolapse is the result of the descent of the uterus and cervix into the vagina. Signs and symptoms include urinary urgency, frequency, and incontinence, incomplete bladder voiding, vaginal dryness or intention, and low back pain. Treatment involves pelvic floor muscle training, core strengthening, and possibly an intravaginal mechanical support device or a pessary. The prostate, we have prostatitis. The cause is bacterial infection or backup of prostate secretions. Signs and symptoms include a watery urethral discharge, urinary urgency, frequency, or discomfort with urination, and pain with ejaculation. Treatment involves lifestyle modification, biofeedback training, and pharmaceuticals. In the penis, we have erectile dysfunction. This affects up to 25 to 85% of all men with diabetes. It also affects men with hypertension, multiple sclerosis, alcohol use or smoking, and hormone imbalances. Signs and symptoms are the inability to maintain an erection. Treatment involves pharmaceuticals, penile injections, Kegels, surgery, and lifestyle modification. In the kidney, we have renal failure, two types, acute and chronic. Acute renal failure is the sudden decline in renal function, increase in bun or creatinine levels due to shock or hemorrhaging. Signs and symptoms include nausea, vomiting, fatigue, weakness, anorexia, headache, and pulmonary edema. The treatment involves pharmaceuticals, diuretics, hydration, and possibly hemodialysis. Chronic renal failure is the progressive deterioration in renal function. Signs and symptoms are the same as acute renal failure but more intense. Treatment almost always involves hemodialysis, and these patients may possibly need a transplant. Kidney disease staging. Stage 1, kidney damage with GFR, glomerular filtration rate, greater than 90. Stage 2, GFR 60 to 89. Stage 3, GFR 30 to 59. Stage 4, GFR 15 to 29. And Stage 5 is considered kidney failure with a GFR less than 15. Hemodialysis involves 3 sessions per week. Most patients will have a Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday schedule. These sessions are 3 to 5 hours per session. Side effects after hemodialysis include fatigue, anemia, itching, and restless leg syndrome. In the bladder, we have neurogenic bladder. The cause is damage to the cerebral control of urination. Signs and symptoms include frequent UTIs, kidney damage, inability to empty the bladder, or the loss of the urge to urinate. Treatment involves catheterization, abdominal massage, and pharmaceuticals. Urge urinary incontinence is due to detrusor muscle overactivity. Signs and symptoms, this is a triggered incontinency, such as key in the lock incontinency or running water triggering the urge. Treatment involves behavior modification, biofeedback, and pelvic floor training. Overflow urinary incontinence. The cause is outflow obstruction of urine due to narrowed or blocked urethra. Signs and symptoms include difficulty initiating urine stream, weak urine stream, and post-void dribble. Treatment involves surgical intervention for the obstruction. Functional urinary incontinence is incontinence due to inability or unwillingness of a person to get to the bathroom prior to bladder release. Signs and symptoms include impaired cognition or mobility. The incontinence is often secondary to the impaired cognition or mobility. Treatment involves improving mobility, modifying clothing, or increasing independence. And finally, urinary tract infections infect everyone but have a higher incidence in women and geriatric populations. Signs and symptoms include increased urination, pain or burning with urination, cloudy urine, shakiness, fever, back pain, and fatigue. The treatment here involves antibiotics and lots of hydration. That's it for episode 8.2, Genitourinary pathology. Episode 8.3 will talk about obstetrics and gynecology. As always, the outline will be in the show notes. Thanks for joining.